Some people are more likely to experience health problems from breathing in wildfire smoke than others. These include people with chronic conditions such as asthma, chronic obstructive pulmonary disease, COPD, heart disease, diabetes, and high blood pressure. These conditions can make the lungs and the heart more sensitive to the effects of smoke, such as inflammation, reduced oxygen supply, and increased blood clotting. People with these conditions may experience worsening of their symptoms, such as shortness of breath, chest pain, coughing, wheezing, and fatigue. Another group of people who are at higher risk of health effects from wildfire smoke are pregnant women. Smoke exposure during pregnancy can affect the growth and development of the fetus, increasing the risk of low birth weight, preterm birth, and stillbirth. Smoke exposure can also affect the placenta, which provides oxygen and nutrients to the fetus. Pregnant women may also have reduced lung function and increased blood pressure due to smoke exposure. Infants and children are also more vulnerable to the health effects of wildfire smoke than adults. This is because they have smaller airways, faster breathing rates, and less developed immune systems. They are also more likely to spend time outdoors and be physically active, which can increase their exposure to smoke. Smoke exposure in children can cause respiratory infections, asthma attacks, bronchitis, ear infections, and reduced lung function. It can also affect their brain development and learning abilities. Elderly people are another group of people who are at higher risk of health effects from wildfire smoke. As people age, their lung function declines and their risk of chronic diseases increases. They may also have other factors that make them more susceptible to smoke exposure, such as living alone, having limited mobility, or taking medications that affect the heart or the lungs. Elderly people may experience more severe symptoms from smoke exposure, such as difficulty breathing, chest pain, irregular heartbeat, confusion, and dizziness. They may also have a higher risk of death from smoke exposure. Finally, people with COVID-19 or who have recovered from COVID-19 are also at higher risk of health effects from wildfire smoke. COVID-19 is a respiratory disease that can cause inflammation and damage to the lungs and the heart. Smoke exposure can worsen these effects by causing further inflammation and reducing the ability of the lungs to fight off infections. People with COVID-19 may experience more severe symptoms and complications from smoke exposure, such as pneumonia, respiratory failure, blood clots, heart attacks, and strokes. People who have recovered from COVID-19 may also have long-term effects on their lungs and their heart that make them more sensitive to smoke exposure. Wildfire smoke is a mix of gases and fine particles from burning vegetation, building materials, and other materials. It can harm your eyes, irritate your respiratory system, and worsen chronic heart and lung diseases. To protect yourself from wildfire smoke exposure, you should follow these tips. Get prepared for the wildfire season. Check your local air quality reports and the U.S. Air Quality Index regularly. Have a plan to evacuate if needed. Keep emergency supplies and medications on hand. Use a portable HEPA air cleaner in your home or office. This can help reduce the amount of smoke particles in the air. Make sure the air cleaner is the right size for the room and follow the manufacturer's instructions on filter replacement and maintenance. Visit public spaces with cleaner air. If you do not have an air conditioner or a HEPA air cleaner, you can seek shelter in places that have good ventilation and air filtration, such as libraries, community centers, or shopping malls. Avoid places that allow smoking or have other sources of indoor pollution. Limit outdoor exercise when it is smoky outside. Physical activity can increase your breathing rate and expose you to more smoke. Choose lower intensity activities or exercise indoors if possible. If you have asthma or other respiratory or heart conditions, follow your doctor's advice about your medications and management plan. Wear a face mask that can filter out smoke particles. A cloth mask or a surgical mask will not protect you from smoke. You need a mask that is certified by NIOSH, National Institute for Occupational Safety and Health, as an N95 or P100 respirator. These masks are usually available at hardware stores or online. Make sure the mask fits snugly over your nose and mouth and does not have any gaps or valves. Replace the mask if it gets damaged, wet, or dirty. By following these tips, you can reduce your exposure to wildfire smoke and protect your health. Remember to pay attention to local health warnings and seek medical help if you experience any symptoms of smoke inhalation, such as coughing, wheezing, chest pain, or difficulty breathing.